Live from the capital city, Georgetown. Political, legislative, economics, and current affairs. The People's National Congress Reform, PNCR, presents Nation Watch.
Welcome, Guyana, to Nation Watch for today. Of course, today we decided to take a break from our regular political discussion. Of course, as you know, recently we've been talking almost every week about the need to have local government elections in Guyana. Even though that is an important topic, there are other issues in society that we definitely needed to shed light on. So today we're doing just that. I am Malika Ramsey. Thank you very much for inviting me into your homes today. October is Breast Cancer Awareness Month. Of course, you know that has affected, it's a disease that has affected our entire society. Some have lost mothers, sisters, friends, and of course other relatives. Some even lost grandparents, grandmothers to the disease. And of course, remember, it not only occurs, breast cancer not only occurs in women, but it also occurs in men, even though the cases are not as many, not even near as many as women who have who are suffering with breast cancer and who have died, and you know, some of them who are very, very, very ill at this point in time. With me to discuss this very sensitive and very important issue is Dr. Karen Cummings. Of course, Dr. Cummings is an APNU member of Parliament, and of course, she is a practitioner in public health. Welcome, Dr. Cummings.
Thank you for having me.
All right. Apart from our discussion, we will bring to you a clip that basically is telling you exactly what breast cancer is all about and what are some of the things that you need to look for. It also explains how you should take time to examine your breasts and do the regular, the necessary checks. But of course, that's why Dr. Cummings is here to talk to you about it. Of course, she is the expert in the health field. Dr. Cummings, for our viewers, even before we show the clip that we have lined up, in plain, simple terms for women at home watching, what really is breast cancer?
Breast cancer, Melissa, is a malignant cancerous tumor which will gonna cause the patient harm. It develops from the lining of the ducts, from the milk ducts, or the lobules around the ducts. So you have two types of cancer. It could be either ductal cancer or lobular cancer. Now, cancer is the second cause of deaths in women. Cancer deaths in women. It's the top cancers in women, but it's the second one that causes deaths. Okay.
What's the first? Just to, if I may.
The first is lung. The lung.
Okay.
The lung in terms of deaths, but cancer is first in terms of the highest number of persons having breast cancer.
Okay. All right.
As you rightly said, it affects men as well. For instance, in the last statistics I recall from the United States figures, it's just less than 250,000, 230 something thousand women have female breast cancers, and about 100 of that, like 2,300 and something men have been diagnosed with breast cancer.
Okay. In your field, even before we go to the clip, have you seen a great number of men in Guyana? I mean, aside from the research that you've done in Guyana, have you seen men being treated, having to be treated for it, for breast cancer?
Very rare. I maybe in my practice maybe one or so, but the majority are women, and of course when they come, sometimes are at late stages.
Okay, all right.
Yes.
Finally, before we go to the clip for now, you talked about the statistics and it being the second major cause for women dying. Is there any research done? Has any research been done, or is there any evidence to prove that, look, years gone by, maybe 2 decades ago, women died faster than they're dying now as a result of breast cancer?
I think it's not less. It's, if anything, it may be either increase or the same.
Even with
because of
modern
lifestyle. It's basically lifestyle. James, people are smoking. You have people who are drinking alcohol. If you check the causes. Sometimes you find persons are what must I say, exposed to pesticides, antibiotics for prolonged use.
Oh,
Those are,
and these are
yes,
things that can.
yes,
All right.
yes,
Well, we're gonna
yes.
talk some more
Mhm.
about those causes and what women can possibly do to reduce the risk a little later on. For now, let's take a look at this clip, telling you, reminding you, and actually reinforcing what Dr. Cummings said about breast cancer.
Cancer is the result of mutation of the genes responsible for the growth and health of the cells in the body. This abnormal proliferation may occur to the breast cells, which is called breast cancer. Breast cancer cells may continue dividing without a halt, resulting in a tumor. Breast cancer is common to women, but men are also susceptible to breast cancer. People suffering from breast cancer may not show symptoms at all, especially in its early stages. But a new lump or mass in the breast can be indicative of breast cancer. Generally, any change to the breast appearance, texture, and pain can be a sign of breast cancer. Nipple discharge or redness, breast or nipple pain, dimpling, or swelling of the breast can also be signs of breast cancer.
All right, we seem to be having some difficulties there with that clip. But back to Dr. Cummings. We at the beginning they talked about a woman examining her breast and some of the things that you should look for. The first thing I want to ask you after seeing some of that, what are some of the most common myths out there about breast cancer? Because people read, they do their research, but then someone is would tell another woman this is wrong or this is right. So what are some of the most popular myths we have out there?
Okay, some of them I can come off just off the cuff. They are, for instance, if you use perspirants, deodorants. People think if you use deodorants you'll get breast cancer. If a member of the family has breast cancer, you will definitely get it. It's not, even though it's a predisposing factor, but it doesn't mean that necessarily you will have breast cancer. If you have a lump in the breast, automatically you have breast cancer. The lump could be some benign, like fibroadenoma, we call it, that's something rubbery, and it may or may not lead to breast cancer. More often it doesn't. Persons may think that we normally send patients for mammogram, which is a low exposure of X-rays, and we think that okay, if it's going to cause a cancer to spread. Some persons think that cancer is contagious, but it's not. It's not something infectious.
Okay. All right. Let's go back to the heredity bit. Even though you said that not because someone in your family would have died, a female in your family would have died as a result of breast cancer, it doesn't mean that you will definitely get it. So my question is, how much of a bearing does it have? Is it at all connected in any way?
Yeah, well, you have genes. Yes, people have gotten tumor markers. They have, shown that it runs in genes, but more often it's more, even though it's multifactorial, genetic and environment. But to me, it's the shift is towards, or the scale goes towards environment than genetic.
Okay. Earlier also you talked about lifestyles changing. When I asked you if there are more or less deaths now, you talked about lifestyle changing, exposure to insecticides. What are some of the
But
things?
before you go on to lifestyle, as we back on family history, because they're predisposing factors. So it's either like family, if you have a family history of it, as you mentioned, it doesn't have to be, but it's possible.
It's possible.
Yes, if you had your mother die from it, it's possible. You may die from it if you don't take necessary precautions, so to speak. But basically, personally, if you do not have children, we call it nulliparous. If you had maybe a lump on one side, it's most likely you may have a lump on another side. The person say early menarche, menstruation at an early age, and late menopause. Yes.
These are myths, or these are actual?
These are evidence-based.
These are
evidence-based medicines. Yes. All right. Birth control pills have been proven to enhance the chances of how you're having breast cancer as well. Breastfeeding practices. Persons who may not have breastfed their child or children stand a chance of getting breast cancer.
If you haven't,
have not, yes.
is that something that develops from the milk that would have been left in the breast?
Well, yes, and Yes, I would say yes to some extent. Yes, yes. Because remember that during a child or puberty in your teens, as you
Mm-hmm.
become turn a young lady, as we would say,
Mm-hmm.
there those cells are immature, and so the cells really mature when you have your first child.
Mm-hmm.
All right, they call them differentiated cells or mature cells, and so they can move ward off the carcinogens and
Okay.
the cancer producing cells.
Since it is possible that if, even though it's not a must, it's not that it's definite, but if, since it's possible that if a female in your family would have died from it, the possibility exists that you can get it, and if not take care of yourself, you can also die. How should a woman who would have lost someone in her family approach, uh, in terms of a preventative measure, if it's even possible?
Well, as the clip had shown earlier, that you need to examine your breast. Persons don't examine it; they don't normally have the the habit of examining yourself
Mm.
weekly or monthly, or the case may be. But you should examine your breasts at least every month. The minimum every month. So you would have seen some changes, as the clip rightly showed. You check for the size. If there's a change, one size is big, one side of the breast is bigger than the other. Um, you look for nipple. If there's an inverted nipple, an everted nipple, it's supposed to be out. If it's in, retracted. We have something called a late stage orange, like a kind of orange peel, you know, appearance on the breast. When you know that's the fourth stage, it's started far gone. Sometimes you find well, if you examine your breasts, you look in the armpits, because the tail of the breast goes way up in more or less the armpit. So you may have some, like a swelling. We call it nodes in the armpit there, and that's a sign of cancer. Of course, you may have discharge from the nipple. Normally, milk's supposed to come out, or some clear liquid, but in that case, you have bloody material coming out from the nipples,
Mhm.
and those are signs of cancer.
You talked earlier about also the examination, breast examination, and I've read that it said that when a woman reaches 40, she should try to have that breast examination done annually, not the one where you do it yourself, but in a changing world where and eventually we're going to talk about lifestyles too, in a changing world where lifestyles different, technology is different, do you believe that that age 40 should it be dropped, should that age be
Of
changed?
course, I think it should be earlier. You get in the habit of seeing your physician, examine yourself. Take charge. Take care of yourself. And we always, when we see something happening, it is normally the last after the fact. Then is when we go to see the doctor. We don't have a habit inculcated, but habit of going regularly to see the doctor. Only when you're sick, you're seeing the doctor. When I'm strong, I'm not supposed to see the doctor. So you want to prevent it from happening. Now when it happens, you see what can be done about it.
But as we're talking about that, is there anything that can be done, especially in Guyana, in our society, to reduce the fear? Because you said it earlier, a woman may find a lump in her breast and it may not be anything, but to be sure that it's not something, you need to go check it. But
That's
is
right.
there anything that can reduce that psychological fear? Oh, I don't want to go because if I go and I find out it is breast cancer, then, what am I going to do?
No, you gotta face it up front. You gotta face it. You confront the issue rather than trying to, because the earlier, you need to know. The earlier
Mhm.
you can do something about it. Because fourth stage, you have to do chemotherapy. I mean, other invasive and treatments, which are not always pleasant. And the side effects are, not people not happy about the side effects.
But even
Loss of hair and those kind of things.
Okay. But even before I talk about the fourth stage, that fear, whether we like it or not, it's reality. Have we done enough, or are we doing enough to psychologically prepare women for what may or may not be?
I think, thank God for this awareness program. But we need to
Uh-huh.
have more awareness programs and education on the television, and the doctor-patient relationship. As the patient comes, you want to educate the patient. Spend some time with your patient, and tell them about breast examination and so on. They too, in turn, I find that most of the patients are more passive. They don't like to ask questions, and so you have to be probing and try to get out that information, which they should really have
Be
that
willing
kind
to
of, be
share.
willing to share and want to ask questions.
The fourth stage, how many cases have you seen come back from the fourth stage of cancer. I should ask if it's possible.
Yeah, depends if you, well, fourth stage is really gone to the different organs, metastatize,
Mhm.
metastatize. It has gone to different organs, you know,
Mhm.
so it's really the prognosis there, it's not very good, you know. You want to catch it maybe in the first and second stage, third and fourth, you know, really, you know, it's a little difficult.
Lifestyles. We touched a bit on it
Mm.
earlier. You talked about exposure to various chemicals. How much can a woman do in terms of changing her lifestyle to possibly reduce the risk of developing breast cancer?
Well, studies have shown that if you're overweight, obese, you know, you have a little more estrogen, and that will cause breast cancer. Alcohol too. If you drink a lot of excessive alcohol, you have estrogen there, which is a well, not prerequisite, but will lead to
Mm.
breast cancer. Studies have also shown that if your exposure to like pesticides, you know, the configuration there would lead to estrogen that will cause an increase in breast cancer. Antibiotics, prolonged use, you know. So these are some of the that I can recall that's proven to be examples of or causes of that will cause you to have breast cancer.
Women who are being abused, who are unfortunately being beaten by men, are their chances, are their the risk, is it higher for them to?
I would say so, yes. Blunt trauma, yes. I've known of patients during my practice that would have gotten, when you've asked them, have you, where you had any trauma or somebody hit you there? And so most times it's yes. Yes, so that's, we need to look at that as well.
Okay, so
Yeah.
so that would be
Yeah.
another reason we need to
That's right.
solve the
Yes.
the
Yeah.
problem.
Blunt
of-
trauma, yeah, blunt trauma as well.
Right.
Blunt trauma. I don't know if it's a myth or what, but I found that sometimes when I've, you know, because as a good doctor, they say the more you take a history from the patient, it's a good doctor takes, uses a stethoscope, but a better doctor takes the history from the patient. And for some reason, I mean, I haven't done studies on it, but I've long ago patients used to put their money inside, money inside the, you know,
Mhm.
what those days?
Yes,
Money
I know.
inside of the bra.
Women still do it sometimes. They still do it.
Yes, and a few, not many. I haven't done any study as such, but I've two of them persons I recall had breast cancer were associated with that. I don't know if it's the trauma or you know whatever, but when I looked trace back, at least those two persons they used to put money in their bra.
And they developed.
Yes, I don't know. I don't. It may be single by itself or concomitant with other things. But I recall asking patients, so what do you put anything in your breast? Do you have any trauma there? She said, yes. Well, I put my money there, and I don't know, you know, whatever.
So
Yeah.
basically, you're just advising them
Yeah,
against
yeah, be
it.
careful. Yeah,
And
so
we-
keep that side clean, just to don't put any things inside
Exactly,
the bra.
and it's
Yeah.
modern. It's easy to pick up a wallet anywhere.
That's
just,
right.
you
That's
know,
right.
Don't put
That's
the money there.
right.
Recently, there was this article on social media, of course, on the network, saying that look, the more you squeeze a woman's breast, whether she does it herself or you know her male partner does it, it would kind of reduce the risk, reduce the chances. Is that a myth? I mean, I know you didn't mention it when you were talking about myths, but do you know whether it's a myth or it's actually true?
I have not studies. I have not. What time? What time during the because remember women menstruation? There's a cycle.
Ah.
So I know during the menstruation it's very painful.
Mm-hmm.
You know, and even when you ask them to examine the breast, you ask them to do it like a week after the menstruation, the menstrual cycle. But I have not heard of that one, squeezing the breast. Maybe.
All right. Well, we're gonna put that one aside for now. I want to pull the men in on the conversation now. Most times, our men in society are most of the times, are only exposed to breast cancer if they have to care for a loved one, whether it be a mother, sister, wife, you know, who you know is suffering, who is ailing from the disease. Is enough being done, or I should ask you, what else can we do to get men a little more involved, to remind them that you know you can also develop breast cancer?
But we have to try and educate them, and programs like these where we make them more aware As I said before, it's a small percentage. It's not very many. For instance, whereas the women, the prevalence of women is about 200 and something thousand. Men is just like 100 of that, 2,000 something. But it's possible. It's possible if you have the gene for it, or if you have some other, trauma or whatever. But very rare. I think maybe in my life I've just seen maybe one case. Very, very rare. Very rare. But they need to be more aware of it anyhow.
The rare case that you've seen, did it
Yeah.
result in death, or was the patient able to bounce back?
I-
I know of an
it's-
American
it's a-
actor who got it, and of course, I think he got rid of it. Of course, he didn't die.
Yes,
But
maybe it was the stage. Maybe it was
Yeah.
just an early stage.
Okay.
Yes.
So-
it's an early stage, and anyone else, your guess is just as good as mine. They will bounce back
okay,
in early stages.
whether it be male or
I would
female.
think so. Yes, it's the early. The thing is, a screening, early detection, and you do something about it. You know if you've gotten it, and you speak to your healthcare provider, and you do something about it. Whether it's surgical or chemo or radiation, whatever, depending on the stages.
In 2014, is Guyana medically equipped, properly medically equipped to treat patients, not only in terms of treating them, but early detection? Are we equipped? Can the health system handle that?
I am not sure. I'm not sure. First of all, I don't know how our registry stands. If we have a database of those who are who are have been diagnosed with cancer, that's first. We have to make sure we have a database for that. Then secondly, in terms of the diagnosis, our pathologists, I think we may have one or two of this big country. We need to have more pathologists. I know Dr. Niall is saying, and Dr. Walcott, but one in West Dem, and Dr. Niall has so many cases. We need to have more pathologists to make diagnosis. So biopsies and so forth, and when they return, if there is any follow-up and so forth. So I think we need to sharpen in terms of our database. We need to sharpen in terms of our diagnosis. I guess we may try with our screening because it's physical examination and history taken, and we may try with our mammograms because we may have private hospitals doing mammograms. But we have to. There's room for improvement.
How would you, I mean, I always like to, it may not necessarily always be a good thing, but I always like to look at the worst case scenario. Let's say a woman, maybe with a single mother, maybe with 4 children, discovers that she has breast cancer, and of course she can barely afford to look after her 4 children, much less to deal with the fact that she has breast cancer and maybe no one else to turn to. Do you find that our nation is, caring enough to probably reach out and say, provide, if not free, but at some sort of reduced cost to help to deal with that? Because if the woman dies, we have another problem on our hands. We have 4 children who are motherless. Do you believe that we've done enough, or that we're caring enough nation to do such? Are we in a position to do that?
First of all, I think when we approach medicine, it's really a multidisciplinary team. You have the social worker, you have the the pathologist, we're working together as a team. And so I find we don't always you have to be wondering, there isn't any social worker, so there's always this pulling. So our team, we need to get the right team. And then after that, of course, so it's a matter of social security, the human services issue.
Okay. Are there, in studies that you would have done in your experience, are there projections, if we don't do this in the next decade, or maybe in the next 5 years, we'll have so many women or so many men coming down with cancer? Are there such research? And
I know that there was a periwinkle group by Ms. Wallace Best and our team, but I haven't gotten, I've been hearing from them recently. And of course, you must have goals. Of course, you want to know, and you want your goals got to be SMART goals. We normally talk about specific, real, and so forth. And so you want to know what's happening right now, where you are, and where you want to go. And so depending on where you are, you're able to present. You want a reduction by 20, 50, 20, whatever, by so much percent. So it depends on where you are. You have to know where you are first. Do a needs assessment, not a needs assessment, but find out what's happening right now, what's on the ground, what is our registry, and
So, as it is now, we don't we know where we are in Guyana?
I am the accuracy. I'm not sure of the accuracy of the data. I will have to query that in terms of accuracy.
Okay.
if what's reported is actually what's happening in Guyana,
Okay.
you know,
All right.
or if we have unknown cases or that kind of thing.
Okay. Viewers, if you're now joining us, of course, this is Nation Watch, and we're talking about breast cancer awareness. Of course, October is Breast Cancer Awareness Month, and of course, the main aim is basically to knock out breast cancer. I know persons are worried that, cancer is maybe the disease to wipe out the nation. Well, not nation as in Guyana, but the world, because you don't know. Of course, I'm going to talk to Dr. Cummings about that soon. You don't know when it's coming, and we've heard that it only pains in its last stages. So that's what we're talking about today: breast cancer awareness, because of course it's Breast Cancer Awareness Month. That is October. Dr. Cummings, over the past years, decades, I should say, we have seen Guyana done a really, really fabulous job in terms of reducing cases of HIV and AIDS. And I think that apart from contributions we would have probably gotten from international communities, I think our advertising campaign had a whole lot to do with that. I mean, you tell people, protect yourself, try not to have sexual activities while you're under the influence of alcohol. And we had various campaigns. We've seen the billboards and the conferences and the seminars. What is it going to take to launch something like that as it relates to, not only breast cancer, but cancer in general?
We have to be strategic. We have to be strategic. As I said before, from our research or what we have there, we'll find out what stage the persons will normally come in. If stage 1, stage 2, stage 3, stage 4. But by and large, we have to keep promoting. I believe in I like preventative medicine rather than curative. And so I will always I'm big on health promotion, TV ads, TV programs, educating the public, about your lifestyle, of course, alcohol. In fact, people know what to do, it's just to get it done. People know they're supposed to exercise, to eat healthy, But who am I to tell me? I just feel like eating that chicken. I just feel like, just go ahead and do it. So it's basically lifestyle changes, lifestyle modifications. Of course, as we go back, we have risk factors which are modifiable and non-modifiable. Of course, you can't do anything if you're over 50. You can't do anything if certain things you can do. But what you can do in terms of your lifestyle, in terms of your eating habits, in terms of your exercise, your physical activity, in terms of your alcohol, you need to limit your alcohol intake. Things like that. We can do.
But are these things really, because people may be like strange. Are these and here I'm going to specifically talk about breast cancer. Are these things really, would they really reduce the risk? When I say these things, I mean what you mentioned. You talked about exercising, the things that you eat or the things that you don't eat. Can these things really have studies proven that they can reduce the risk?
Yes. For obesity, because of the obese, you got fat and estrogen. Because of the increase in fat, there's estrogen with it, increased estrogen. And so some of these tumors are estrogen tumors, so we have to decrease our estrogen, and if you limit alcohol, you decrease estrogen in it, if you try not to be obese and do a lot of exercise and keep it in your your BMI, you should be able to, your body mass index, you should be able to improve.
In terms of treatment, how available is chemotherapy in Guyana for patients with, and specifically to breast cancer?
I think I haven't been to the wards for some time now, but I think we were able to do radiation and chemotherapy here. I don't know if it still remains right now, but as I speak. But we used to have done it. I know when I was in my medical school, we did radiation therapy, and we did some. There were chemical drugs that we use to slow the process down.
It has been said that sometimes I guess it depends on the person's immune system, that the chemotherapy can actually weaken your system. While it may help to take away the breast cancer or whatever cancer you're suffering from.
Well, the idea behind this treatment is to kill the cells and don't harm the good cells. So that's the objective behind it.
What are the chances of the cells coming back, being reproduced?
Because we are human, and sometimes in terms of radiation or so, because we are human error. You may not be able to cover the entire cancer cells, you know.
Okay.
Yeah, that's really something you follow it up with chemo, you know. But like everything else, it's preventative treatment, the therapy we're going towards, and you need to examine your breasts. There's no shortcut for that. Examine your breasts, speak to your doctor, visit your doctor a little more often. That's simple.
Have you seen or heard of any cases where maybe teenagers have been found to have or to have developed breast cancer?
Oh, very rare, few, very rare. What they have is this fibrocystic breast, and they have like fibroadenomas, which are benign tumors, you know, no cysts and so on. But I rarely, not very often, you may have a breast cancer. But I said before, it's very there at that stage in the teens. It's very sensitive to carcinogens, and so you have to be very careful because it's immature cells. And I said the breast cells don't be mature until you have your first pregnancy. So you just have to be careful.
So even an adult with no children could have it. I know
That's
why you're
right,
laughing.
That's right. Yeah,
So-
no
But
harm.
is it fair to say then, in a teenager, if you discover something in a teenage girl, that it may be a little easier to probably treat it and get rid of it than if you're an adult? Is it fair to say that?
Well, we have to know you can't. Well, you have to go and examine because you can't tell. She may be she may be the unfortunate one.
Okay.
You know, but the idea is to just visit your doctor, examine your breast. If it's monthly, after your period, the week after, and you know if you find there is a lump there and the size of the breast, something is wrong there. The nipple looks a little different. There is some discharge oozing from the nipple, but then you need to consult your doctor, your
Yeah.
physician. Yeah.
Let's come back to this major campaign that I was talking about earlier, whereby we get funds from the international community to tackle other issues and other endemics. Do we need international assistance and maybe international fund to do more promoting, and so that we wouldn't only be hearing about breast cancer and women who we've lost, we won't only be hearing about it during the month of October every year?
Yes, I think we can start in the schools. You know, have these pep talks. Have long ago we used to have guidance for school. You know, you used to have guidance like sessions, like every Tuesday morning or sometime in the afternoon after lunch. You have these guidance sessions. Somebody come in and talk to you about these things. I think we should go. That's the way to go. Start with very young age, so they'll be very aware by the time they become an adult.
What advice would you, as a female, and this is outside from the program, give to other females out there, especially the ones who may be, fearful, who may not be able to afford to go do their regular breast examination? And again, like I said, because the fact is, I talk to women, there are some women who are genuinely afraid. What advice would you give to them?
Well, we already have spoken about the myths. You you can't get it by deodorant, as I mentioned before. You know, it's not contagious. You know that, what else? What else did I say? We have to, you just have to examine your breast every month. Just check it out. Of course, you recall your family history. If you know your mommy would have died from it, or it's in the family, or two sisters would have died from it, sibling, well, you have to be more aware and alert, and so that you will not, be more conscious and of any changes in your breast, So, but the thing is that you keep, going your monthly or your every 2 months visit to your doctor, and a doctor should examine you every time, from head to toe, and so the two of you in partnership would be able to, ensure that you're not in any screening tests done, your mammogram, you would definitely not be at risk for, because of early detection, most likely your chances would be lessened.
Are we at a place in Guyana whereby we can probably provide counseling for those families, especially in the cases of very young children who would have lost their mothers? Should there be some sort of special counseling for them, apart from the fact that they may be afraid that they eventually end up like that, and then the fact just because they are grieving, should we have some sort of special counseling for these families?
Of course, that's in place because there are different stages of grieving, and you need to be with them for some time. It will take it's a process, and so you need to if they don't have any immediate relatives, you know, to grandmother or so. Then you need to have some kind of place where you can take in that slot, so to speak.
Okay.
You
All
know,
right.
yes.
Viewers, of course, you're tuned to Nation Watch, and we're discussing breast cancer awareness. What I'll do, I'll ask our operators to set up our phone lines, because some of you at home may actually have questions that I didn't get, or questions that I didn't think about. So I'll ask our operators to put the numbers up on screen, and you can call and pose your questions to Dr. Cummins. And of course, remember, we're talking breast cancer awareness, because October is Breast Cancer Awareness Month. Now, I said in the beginning of this program, Dr. Cummins, that we're really taking a break from politics this week. But as you know, politics has to come in somewhere along the line. Has the Ministry of Health done enough in terms of public awareness? Because sometimes it's irritating, because you hear in the month of October, you hear about all these different marches. People wear pink, you see the pink ribbon, we're saturated with it, and that is really a good thing. I'm not saying that that's not a good thing, but my concern is that when we get to the end of October, we don't see these pink ribbons and hear about these stories and see this massive campaign until the next year. So this is not just about us as citizens. I'm talking now specifically about the health ministry. Have they done enough?
I think they may have done, on a scale from 1 to 5.
Mm-hmm.
Maybe I would score them 3 out of 5, if maybe. But there's room for improvement, of course. And I think they should work with, as I said, the cancer registry, because these are patients who would have diagnosed and will go there, for follow-up. They should work with the health centers, at the primary health care level. Work in the schools, have what we call it, health clubs, and so you can sensitize the students and the potential victims, if I can use that word, about breast cancer, what it's all about, how can I get it, what are the predisposing factors, what are my risks, what can I do, how do I examine my breast, brochures, they can do some more.
They can do more.
Yeah, they can do some more.
All right.
It's never enough.
And I trust that APNU would eventually be in a position to do more.
But that goes without saying. That goes without saying.
Great, Dr. Cummings. We're chatting breast cancer awareness, and of course, this is a Nation Watch. Join me on the other side of the break, when we will take some of those calls and chat some more with Dr. Cummings.
We need someone to take us to the start, lead us to a place nice and warm, yeah. Who's gonna clean up all this mess? 19 years of endless stress.
Ranger, take over this government.
You can hear it east, north, south, and west. People calling for the best.
Ranger, we want you as president.
Mr. Ranger is the man to lead this nation, to bring a better future for this generation, for build better schools, better education, for bring back the reputation. Now we want a government that is trustworthy, provide employment and maintain security. Whether you're black, Indian, Amerindian, Chinese, a good life for all you Guyanese. We fed up of all the PPP.
Vote APNU.
Welcome back. I keep pausing every time I say Nation Watch, because I almost said facing the nation. Of course, I guess it's a force of habit. If you're now tuning in, this is Nation Watch. We're talking breast cancer awareness, and of course, it is October, Breast Cancer Awareness Month. And those of you on the inside, I know you're probably a bit cold right now, which is a good thing from all the heat that we've been having, because it is pouring out, of course, especially here in Georgetown. Dr. Cummins. Even before viewers, our phone lines are now open. Of course, the number is on your screen. You can call us on 223-5192 and pose questions to Dr. Cummins that you may have on breast cancer, questions that I may have probably missed. Before we went to break, we were talking about what the health ministry needs to do, and the topic of health centers, or health centers in Guyana came up. Persons would have been complaining, of course, and this not only has to do with breast cancer or any other sort of cancer. People were complaining recently about the service that our health centers provide. If we're going to deal with specifically health centers as it relates to breast cancer, because people get ill at any time, do we have trained persons at these health centers to deal with various ailments, various illnesses that may happen overnight, at weekends?
Well, Guyana, the ministry boasts that they have 200 and something doctors came back from Cuba.
Uh-huh.
I'm not sure if all the health centers are equipped with doctors, That may be a problem. Some may have abundance, and whereas some may have not so, maybe depleted.
Okay.
So the staff is very important to have this one-on-one, taking time out to spend some time with your patient. Because remember, primary care is the first line. You're seeing this patient maybe for the first stop. And so you have, to spend some time with your patient, take as much history, listen to what they're saying, ask your necessary questions, so that you can ascertain and make your correct diagnosis. But that's the first. You don't want to miss that opportunity, of getting as much information as you want from your patient.
Okay, all right. And of course, they feed, so the persons who are trained should be able to process that and take the necessary precautions or necessary measures.
Yes, I mean, common things are common,
Okay.
common things are common, so we should be able to.
Caller, turn the volume of your television down, please. Are you there? Caller, are you still with us? Caller? Alright, viewers, you know the usual rules. When you're coming through, of course, you have to turn the volumes of your television sets down. You have to be brief and come to the point quickly. Of course, so we only have a few minutes left in the program. Dr. Cummins, anything that we may have missed that you'd like to touch on again, just so people can really understand what it is that we're dealing with and how it is that they can protect and protect themselves and, try to reduce the risk, as much as they possibly can?
Well, basically, I just want to underscore the point of early detection. They need to come to the health center or the health facility, and they need to ensure they have screenings. So you ensure you have your mammograms done. You have your, by extension, VIA in some cases, and cervical cancer just in passing. But we need to have our screenings done, and we need to spend time to examine our patients, because sometimes in just a casual examination you may pick it up and the patient didn't recognize it. They haven't seen the changes on their breast. They haven't seen that, okay, this one is inverted, whereas this one is everted, and so forth. You have examined them, you check for nodes in the armpit, and there is a swelling there, and they haven't recognized it. They don't know what to look for. So you, the health personnel, you're expected to be a little ahead of the game and inform them of their status, in terms of.
Those same changes would also be seen in the case of a man if a male develops it, or is it different?
It's basically the same in the sense that there was a swelling and the lump would be there. And most times when the lump is in the male, it's more often it's cancer. Whereas if the lump is in the female, it's not necessarily cancer. It could be benign, some fibroadenoma, some benign tumor.
I think we missed this though. What would be if a lump develops in the breast of a male? What we talked about the causes in terms of women. What would cause it for the men, even if it turns out to be breast cancer?
Well, what I did miss, there's some we call it iatrogenic cause of a lump in the breast of a male. Like, for instance, we call it gynecomastia, and there are certain conditions that could give you that. All right, if you're on certain drugs, I don't want to call it drugs name, because we have pharmacists out there, but there are certain drugs that can cause a swelling of the breast in males. Certain drugs, all right. But you will know the difference when it's iatrogenic coming from a drug or definitely some trauma or some other problem.
Let's see if we're going to get this call. Caller, are you there?
Yes. Good morning to you.
Good day. You need to turn your volume. Yes, caller.
Yes, I understand that you're discussing this morning something medical.
Yes, sir.
Well, I'd like to sort of expand that discourse to include some thoughts that are seemingly affecting the entire political process in the nation at this point in time. I've tried on several occasions when you had the leader of the opposition and certain other influential persons on board your program.
Yes.
I want to think that all the concerns that we have regarding the medical sector, the agriculture sector, the productive sector, the social sector, and the like, all seem to be falling in a pattern of separated action, meaning that with all the concerns that are being expressed, there's no action that's being taken by all the different groupings, private sector, governmental, military, and the like, in order to put the idea of togetherness into effect. And I'm going to address this point particularly to the fact that the leader of the opposition led a protest just a few days ago, and he seemed to be out there a man on an island. I want to think that if there's an APNU structure and people are sufficiently convinced of the problem, then every representative group needs to get into a point of concerted action, both on television programs for discussion, both in terms of letters to the editor that goes through the newspaper as complaint issues, and both in terms of meeting the people, because when it results that political action is segmented and disconnected, it appears as though only one or two pressure groups are interested in the point of reference. And I say this to mean something very strongly militarily, because I've been a military officer under the command of the general, leader of the opposition. And I know if he hears this program, he knows my voice. He will know exactly it's Arnold Cristiani speaking.
Okay.
And I want to think that if we're going to get any meaningful results in this new dispensation, particularly leading up to the no confidence vote, we have to be able to get all the interested parties in a particular problem situation working together on the issue, seeing them out there as a protest group, hearing from them on programs like this one that you're running, the APNU representative, all the different persons that forms that grouping, so that the people can be convinced by and large, because almost 60% of the electorate in this country are not politically very au fait with some of these issues that are being discussed. They don't understand political strategy. So to any extent that we're not concerted and we're not competent in terms of a strategy, particularly for any particular outcome, then it does not bring about the result that we need to achieve in the short run. And I would certainly want, coming out of this no confidence situation, whether it results in an early election or election to 2016, that the whole political process now gets definitive action in terms of being result-oriented rather than complaint-oriented. So that's the thought I'd like to throw. And even medically, any issue of health, when a minister could say that people that he would be glad if there's a catastrophe in Georgetown, so that he can install in the IMC on the people, then those kinds of thinking are way beyond acceptable level. And tolerance is the issue where the people and their vote is concerned. And we can lead any strategy in that connection. So thank you very much, Ms. Ramsey, and
thank you, sir. Thank you very much, sir. And interesting, even though the caller was off of our topic, it's very interesting. And as I said, even though our program today is not, and it was not designed to focus mainly on politics, but to focus on breast cancer and breast cancer awareness, it is interesting, and I'm really, really happy that the caller did get a chance to come through and put his sentiments out there, because of course it reminds us that, look, the issues that we're faced with in Guyana, it's not only the opposition that's complaining about it. Of course, you heard the gentleman himself said that it's time for us to move past the complaints. We need to do something about it, and the only way we'll do that is if we unite. And that's what struck me from what he's saying, and trying to link all of these issues and all of these problems that we're having in terms of finding a solution. I don't know if you have anything to add to that, Dr. Cummings.
Yes, I'm very grateful for that submission, Malaika. I think the guy is the call is on target. I mean, well, first of all, we're a partnership for national unity. We it's a partnership, and people can still come on board right now, because we not only PNC, but you have other WPA and others on it, and the private sector could come on board, but we're not going to sit and wait for them to come. I mean, God is willing to work with many as well as few, who want to come with us, come forward, who don't want to stay at the back, but we're going to move forward with many or few. But of course a team effort is important. There are things you need to work together as a team, and I think the call is right on target. On target.
All right, I think we'll have to take this final one before we have to go. Caller, are you there?
Good afternoon.
Good afternoon.
Good afternoon.
Good afternoon, you're on the air.
I would like to know, is there any way that you can go to test your breast for breast cancer free? Because I think the price for that is $5,000. If the public hospital does it, or where could I go? I don't have $5,000.
Okay, thank you.
But my mother died from breast cancer.
Okay, well, our sympathy to you, ma'am.
Has she done her screening? Has she screened her breast?
Caller, are you still there?
Yes, honey.
Have you done your screening? Dr. Cummings is asking.
No, I don't do anything. No, I haven't done anything.
Okay, well, could you start as early as this week?
Pardon me?
This is Breast Awareness Week, so I would like you to go and do a mammogram. You go to any health center, and they should be able to examine your breast and show you how to do it.
Okay.
And you may have brochures as well to assist you in that regard.
Is there any specific health center?
It depends on where you're living.
Your catchment area. I don't know where you're living.
I live in Lamar Street, Newtown.
Lamaha, Newtown, yeah.
Kitty is nearest, I think, or Campbellville, or is that?
Camberville would be also close. There is one in Camberville, that's on First Street.
Okay, I know where.
Yeah, you know where.
Yeah.
Okay, yes. Dr. Cummins, so what time can she go there?
Well, I think the working hours are 8 to 4. I think 8 to 4, 8 hours. So anytime during. Of course, they may have scheduled clinics, so she may need to call and find out when.
Call
you
ahead.
know, yes.
Right, caller?
Yes, I can do that.
Okay, all right.
Thanks a lot.
Thank you very
Welcome.
much for coming through, and of course, thank you to you too. Well, we're not. Our phone line seemed to. Well, we'll take this final call. Caller, are you there?
Good afternoon.
Good afternoon.
A friend just called me and told me she went to the bathroom yesterday afternoon after having some gripes. And instead of having a motion, it was pure blood she was passing. And she wants to know what to do.
Dr.
I
Cummins.
told her she better see a doctor as early as possible.
Yeah, that's right, because we don't really diagnose over the phone, but we have to, to see her and examine her and put our finger up. If it's something in the abdomen, we have to examine her from the anus.
She is
Yes.
over menopause.
Okay. Wow, well, we have to watch that postmenopausal bleeding. We have to, that's a red flag.
Okay.
Yes, so we may have to find if it's coming from the anus, where it's coming from.
She's asking if she should go to a clinic or.
Of course, that goes, yes, she must seek medical advice.
Which community are you residing in, caller?
She would be the festival.
Festival City. Yes,
Okay.
and I know definitely there's a clinic there.
Tomorrow's a holiday.
Okay, no, but you have the Georgetown Hospital.
Sounds to me like Georgia Hospital.
Yes, you can go there, yes.
Thank you very much, caller.
24/7, yeah.
All right. Unfortunately, that's our final call. We're gonna have to put a wrap on things, but before I even wrap up, I just want to, apart from the two callers who actually focused on the topic, I wanna touch on what the gentleman talked about earlier, the fact that we need to be we need to be proactive and we need to be
yes.
united. I just want to
Yes.
also remind the folks that sometimes you may not be seeing the amount of persons that you would like to see on an APNU picket line calling for local government elections, but I just want to remind you that we live in a society where we have a government that can be very, very vindictive. Some people, most people, we have students, we have people who are working, people who work at various ministries. They may not be PPP supporters, they may actually be opposition supporters. And you just think about if they leave their jobs during the day or they're seen anywhere near an APNU picket line, what the consequences would be. So just keep in mind that we have those people there who are supporting, but they cannot necessarily be seen. And of course, our local media, they're very, very active, and they get almost every and anything on camera, and so we see stuff on the news and we see things in the newspaper. So just keep those persons in mind when you're thinking that we don't have enough supporters out there.
In addition to that, we are having peaceful protests. That's why we have our name tag, because we don't want people to say they're thugs and hooligans and so on our, so we can identify this is a peaceful protest and there's no hooligans in between.
Exactly.
Right, so.
Great. Before we wrap up, Dr. Cummins, final note on our original topic.
Well, I'm happy that we can revisit the topical issue of breast cancer. Persons have been diagnosed, as I said before, it's the highest cancers for women, but the second highest in terms of death rates. And so it behoves the women, I think it's an opportune time for you to go to the nearest health center, visit your physician to show how to examine your breast, make sure you have brochures, read up on it. We have internet now, and you yourself can just, Google it and ensure, that you're informed about this topic. I will encourage you, especially if you have a positive family history, you have some of the predisposing risk factors, be it modifiable or non-modifiable, ensure that you seek help, visit your physician.
Okay, thank you very much, Dr. Cummins. Thank you very, very much for being here. I appreciate it, and I know that the viewers definitely appreciate it. Viewers, thanks for tuning in. I trust that you are going to enjoy what's left of your Sunday. Of course, I always urge you on every single program I do, be good Guyanese citizens, take care of yourselves, take care of each other. Of course, Chris Jones will be back next week with you for Nation Watch, but of course you can always join me on The Public Interest and on Facing the Nation. I am Malika Ramsey. Thanks again. Bye bye.